It's interesting to look at a definition from 1946 that talks about health not just being the absence of disease, but also looking at social well-being and mental state. And when we look at our healthcare system, we certainly have not yet acknowledged that on a system-wide level. And again, health meaning to make whole, and really taking a look at that. And so what is our approach here? Functional medicine, integrative medicine? Are we just doctors giving supplements and prescribing different things, and they're not drugs? We just, here's $500 worth of vitamins, go and you'll be healthy. And that certainly is the knock on a lot of this industry. And that's not our approach. We want to, we will talk about vitamins and herbs, and we certainly employ them. But we firmly believe in an approach where prevention and using lifestyle and nutrition and mindfulness-based practice really is what's most important. And vitamins and supplements and all these other modalities, or at least all these other products, are sometimes layered on top. But we really want to look at this stat here. WHO talking about 80% of heart disease, strokes, and diabetes being preventable. And they talk about 1/3 of cancers being preventable, but I would actually think it's hard to get data on that. How do you collect data on preventing cancer? It's a 10 or 20 year process, and it's hard to study that. But I think at least 30%, probably closer to that 80% number, would be more realistic. They looked at these factors: body mass index, so amount of fat, really, overweight, fruits and vegetable intake, physical activity, tobacco use, and alcohol. So now I get to talk about Dean Ornish. This guy has probably done more for the field in terms of the academic setting than a lot of other people out there. And so he's a cardiologist who originally wanted to show that lifestyle interventions could reverse heart disease. And that's how he originally made his name, talking at conferences on reversing plaque. He's been able to show, and with good evidence and with science behind him, that you can use lifestyle to reverse and prevent heart disease, that you can turn on health-promoting genes and turn off health-causing genes, that you can lengthen these things called telomeres, these little protein complexes at the end of chromosomes. And there's data to suggest that shortening of telomeres is related to increasing disease. So certain cancers are related to shorter telomeres than certain other chronic diseases. No drug has ever been shown to lengthen a telomere, and that's what we want. But lifestyle interventions show that you can actually lengthen telomeres. So it's interesting stuff that's coming out. And you can actually measure these now with some of the labs in the States. So if you look at the prostate under a PET scan, it'll light up where the active cancer is. After 1 or 2 months of lifestyle interventions, you redo that PET scan, and there's less areas that will light up. And that's pretty intriguing and probably pretty important, because we have this group of watchful waiting people with this low-grade prostate cancer that we really don't know what to do with. Are they going to die with their disease, or are they going to die because of their disease? And we don't know the answer necessarily to that. And looking at lifestyle interventions is actually not just, take this drug, oh yeah, and exercise and eat right. It should probably be the other way around when it comes to a lot of these diseases. We've known for years that we can reverse type 2 diabetes, and again, with lifestyle interventions, he's got papers to support that. And he's actually gone one step further and looked at outcomes and cost savings. And this is where you get the politicians' ear, and this is how you're going to bring in big change. He's been able to get his lifestyle interventions in over 40 hospitals in the States and be covered by Medicare. And this is the first time ever that Medicare is funded. This is Medicare, funding lifestyle interventions to prevent illness. So you prove that it saves money, and all of a sudden things will happen. Depression, cholesterol, and weight are other things that go along with what he's been able to study. But this is one of his original papers looking at intensive lifestyle changes and reversing coronary artery disease. Compared with usual care, the lifestyle intervention group had a regression of coronary atherosclerosis versus progression in the control group. So the control group, plaque around their heart got worse. The intervention group improved. So it's not that the intervention group didn't get worse, but it actually improved on PET scan, and that's unheard of in the conventional circles. All the cardiologists will tell you to go exercise and eat right, but they stop there. It's a one-sentence blurb. But really, you can actually undo some of the damage that lifestyle has caused. And he's the first guy to show this and definitively show this. And more than twice as many cardiac events occurred in the control group. So this is the group that had no intervention. So this is the group that didn't, live the optimal healthy lifestyle at 1 and 5 year follow-ups. This is an arterial PET scan showing before and after lifestyle interventions. So basically, this is getting wider and more blood getting through, and this is looking down the artery, and all the color is good, and there's more good after the lifestyle intervention. Not to promote Dean Ornish, but he does have the most amount of research, and we are looking at applying a lot of his principles at Connect Health. Some of his studies are in pretty idyllic circumstances. He'll have people at a nice, kind of, not resort, but a ranch, or I'm not sure where he did it, but they're eating organic foods. They're doing mindfulness-based meditation. They're doing yoga, and they're in a group, and this is kind of a perfect setting, which is not easy to replicate, but certainly does set the standard of where we could aim. So he's looking at what you eat, how you respond to stress, how much activity you have, and the support and love that you have in your life. You are what you eat, and truly, there's data to support that, and we'll talk about the genetics of that. But we talked about eating and stress and activity, but we always forget the connectedness that you have. There's lots of studies to suggest that if you're depressed, you're going to get that second heart attack, and you extrapolate that to virtually any condition. This is a little bit of an unfair slide, but it is a good one to show. This is a Mediterranean diet versus the standard diet that's recommended by the American Heart Association, showing that the Mediterranean diet versus the normal diet that we recommend cut risk by 72% of cardiac death or further cardiac events. So we're just throwing up this number. We're kind of just throwing 72% versus Zocor, which is a statin against placebo. So we're saying that you can have profound impact on reducing bad outcomes using lifestyle versus throwing a statin in billion-dollar industry and probably having more bang for your buck. Metformin is a drug that we use to help with glucose control in diabetics, and now recommendations are suggesting that we give it to people that are close to getting diabetes to slow the progression down. These tall bars are the money that we'd have to spend doing that versus these little blue bars, lifestyle interventions. And then health promotion and disease prevention currently receives less than 1% of the overall healthcare budget. I don't envy our politicians right now with the crunches that are coming down the line, but something drastic, is going to happen. Your genes are not your fate. In med school, you've got your little table that they teach us that you get some genes from your mom and your dad. They mix together, and you have some options, and you're going to get that disease, and kind of that's it. And we're learning more and more over the last 5 or 10 years, and over the next 5 or 10 years, you're going to be hearing a lot more about it. But we truly have the ability to influence, not which genes we have, but which genes are turned on and off. So obviously you're born with your DNA, but you can affect the way you interact with your DNA. So the BRCA gene, have you guys heard of the BRCA gene? It's the one that really increases your chance of having breast and ovarian cancer in women. If you have that gene, 80% of you will get breast or ovarian cancer. Versus they think it was only 30 or 40% around the turn of the century. And I don't know where that data, I keep meaning to look it up, but it sticks in the back of my mind as a great example of, our genes have not changed in 100 years or 50 years. Our environment and stress levels and what we eat and the way, the food chain and pollutants and all of that have changed. So it's quite interesting. Even the scariest genes you can influence. Our health and disease patterns are not hardwired deterministically by our genes, but rather a consequence of the interaction of genetic uniqueness with environmental factors. So again, more than ever, you're in the middle of the interactions between genes and environment. How you live your life each day, diet, lifestyle, mindfulness, community, truly affects your health. It's not anymore just one of these out in the clouds and yoga journals, do your yoga, it's probably good for you. There's data, and it's genetic, and it's affecting your genes, and it's basic science now, and it's actually quite exciting. Nutrigenomics is nutrition and genomics. It's what we eat and how it affects our genes and how they're expressed. We all know broccoli is good for you. It has aflorafane, lots of anti-cancer properties. It helps with detoxification. The way it works, it actually increases the transcription of a gene that then increases glutathione, which is one of our master antioxidants, and helps. And that's one of the ways it interacts with your body. So what you eat, how much you exercise, how much stress you have, the love in your life truly affect the way your genes are expressed. This came out in March. There's all this buzz about looking at the specific genes involved in cancer and going at targeted gene therapy, and that's the future of how we're going to get rid of cancer. And then the New England Journal publishes this article and bursts our bubble and talks about tumor and taking samples of cells at different parts of the tumor, and unfortunately it's got different genes and different DNA at each part of the tumor. So it's not that simple, and so it kind of reemphasizes that we want to get at root causes. We certainly don't want to ignore cancer when it's there and just go after eating healthy. We want to do lots of things at once. But when we're talking about preventing cancer, and disease. That's what we're all about. And the way our genes are working together with our environment is the most important thing. So just highlights the complexity of reducing our thoughts to just a specific aspect of disease and any condition that's out there. Bringing back Dr. Christie's diagram of the complexity of who we are. 3 months of meditating actually will change the expression of over 500 genes. So 500 genes by meditating. Now that's pretty impressive. There's probably no drug that does that. This is something that has only good side effects, and it doesn't cost very much if you're able to do it on your own. Probably one of the biggest reasons why alternative medicine back in the day became so popular. You have an opportunity to sit down with a practitioner and talk about what's going on in your life for an hour and a half, and you feel heard. And it probably doesn't matter so much what that practitioner gave you. You're already feeling better by having that opportunity. And so this paper looked at 3 groups. One was the control, so nothing happened. The other group was getting sham acupuncture, so an attempt at not really doing acupuncture. The third group has the sham acupuncture plus a little bit more warm environment and more interaction with that provider. So they're trying to decipher which part of the placebo is the patient-provider relationship actually influencing. And they found that third group, as you all guessed, where you spend more time and you're having a warmer interaction, benefited people more. Interestingly, sham acupuncture versus control had a better effect as well. So shifting gears a little bit, we're always emphasizing lifestyle factors and food as medicine first. The ones that we will fall back on quite often would be vitamin D. People have heard the buzz about vitamin D. Yes? No? We might find out soon that we might have gone a little too far and we're giving too much to too many people, but in Canada, depending on where you consider the optimal level to be, up to 97% of Canadians at some point in the year will be vitamin D deficient. Associations with deficiency in vitamin D, lots of cancers, heart disease, osteoporosis. The Canadian Cancer Society upped their recommendation to 1,000, and for them to do something, there's got to be some evidence to do it. And even Health Canada, which is ultra slow at adopting new recommendations, went from 400 up to 800. Okay, curcumin. So extract of turmeric, it's very exciting. They're using curcumin extracts in Alzheimer's now, in prostate cancer, and their early findings are very positive. It's an anti-inflammatory, and it's not like aspirin or Advil. It doesn't knock out just one of the paths of inflammation and then shift it down another path, which then causes side effects and ulcers and all those complications that have come out. It actually blocks, both higher up, which is actually a good thing. It's an antioxidant. It helps with stickiness in the blood. There's some evidence about cholesterol, and it's been widely used in traditional Indian medicine, Ayurveda. One of the reasons why it's so exciting is we've looked at root causes of disease. Inflammation is thought to be one of the first things that happen, and maybe there might be an autoimmune issue before that, some people think. But inflammation for neurodegenerative diseases, Alzheimer's, cancer, heart disease, we now know it's inflammation, and that's new in the last 10 years. When I went through med school, it wasn't. There's plaque in the artery, there's some foamy cells, but they weren't really attacking inflammation yet. And so that's why this is pretty exciting, because it's a very potent anti-inflammatory. So probiotics, we feel that the gut plays a pretty fundamental role in your health. It's the biggest way you're exposed to your outside environment. And in your gut, you do have serotonin receptors, which are more in your gut than in your brain, we think. And a good chunk of your immune system, 70% of your immune system, lives in your gut. And so we have lots of little bugs and creatures living in our gut, and we have more of them than we do of cells of us. So there's actually more of them in our body than there is of us. And we don't actually think about that or pay attention when we're giving all these antibiotics and when we're eating stuff with pesticides and when we're smoking and when we're going to McDonald's, and what is going on in our gut. And 20 years of doing that, what is actually happening? Because these little guys are responsible for helping you absorb your vitamin K and digesting things that play a fundamental role. Most of us would benefit from a probiotic. So probiotics giving the beneficial bacteria and helping colonize the gut. Some good evidence for infectious diarrhea, maybe some benefit for certain types of IBS. Certainly there's some evidence, especially in kids with allergies and eczema.
Are the probiotics in yogurt sufficient, or do you need to take like?
It doesn't seem like the yogurt would be sufficient, no.
Depends on the yogurt too.
Yeah.
Maybe make your own yogurt.
Okay.
It has a lot higher cultures than what you buy off the shelf.
Yeah. Yeah. But I mean, the one with Jamie Lee Curtis, with her tummy on the commercial, it's not going to be enough to help with your inflammatory bowel disease, or likely it's not going to hurt. But then we can get into dairy and all of that. But these are some resources out there. So I'll end with a quote: "Be open-minded, but not so open-minded that your brains fall out." Our goal is to critically look at other forms of medicine. So we're not uncritically endorsing everything. Part of our role here is to bridge the gap between Western medicine and non-Western approaches, but not say everything's great. Let's rub crystals on our head and we'll be cured of everything. Like we're trying to have a systematic approach, and one that we can talk in the same language with all of our allopathic colleagues. But we're also not overly critical of Western medicine. It has certainly, done some very good things. We have stats coming out saying people with cancer are doing better than they ever have. We're living longer. It's not just drugs, but there's a whole other thing. But we don't want to throw all that out. It's certainly good in the acute situation in the emergency department. So we're not being too critical of Western medicine, but we're also not being uncritical of everything else out there. And that's kind of the whole philosophy with an integrative approach. And I think you have the honor of hearing Dr. Cheng again here.